Today we're going to talk about gluten and medications as part 3 of our series in managing celiac disease in older adults. As we age, our risk of developing certain chronic conditions increases, and medications are typically used to treat these conditions. So, it isn't a big surprise to know that prescription medication use increases with age. In fact, did you know that in Canada, about 25% of older adults over the age of 65 are taking at least 10 medications? And that this percentage increases to almost 40% of older adults over the age of 85. And if you're someone with celiac disease, you might ask yourself, should I care about gluten in medications? And is there a way to tell if they are gluten-free? Both are important questions to ask, as even a small amount of gluten is enough to induce inflammation and lead to complications. In Canada, our packaged foods are regulated with gluten-free claims. Unfortunately, similar laws are not in place for labeling of gluten content in medications. Currently, there are no requirements for labeling gluten or common allergens found in drug ingredients in Canada. While gluten is mostly found in foods, gluten can also be found in non-food sources as well, such as prescribed or over-the-counter medications. Additives, like excipients that are used to bind pills together, are one of the most common ways gluten is found in medications. Common red flag ingredients that may contain gluten are modified starch, pre-gelatinized starch, dextrates, dextrin, dextromaltose, and colorants. Be sure to check the ingredient label for these specific ingredients. Now that we know some gluten-containing ingredients to watch out for, you might ask, how much gluten can a medication contain to prevent any complications? Well, the good news is that the majority of medications contain no gluten or very low gluten at all. And if gluten is present, the amount is usually extremely low. However, it really depends on how often and the number of medications you are taking. If there is no gluten in the list of ingredients or added excipients like starch, then the amount of gluten is probably very low and unlikely to produce a reaction. Other considerations to think about on the topic of gluten in medications are a few misrepresented ingredients. Today we'll describe the facts of 2 particular ingredients. First, we have sugar alcohols, which we've listed here on the slide. These are highly processed sugars. And the fact is that these sugars are gluten-free and actually contain no gluten. So sugar alcohols will likely not cause problems for people with celiac disease. Next up, we have maltodextrin. This might be seen as wheat maltodextrin or just plain maltodextrin. These are 2 ingredients that are derived from wheat. However, maltodextrin is actually considered gluten-free due to the way it is processed and is safe for people with celiac disease. For a full list of guidelines for food labeling and ingredients when following a gluten-free diet, visit the CCA website for a comprehensive overview. Lastly, what if you suspect there is gluten in your medications? What should you do? Well, if you're concerned that your medications have gluten in them, contact your doctor. Talk to your physician to let them know about your concern or reaction to the medication. Number 2, do not stop taking prescription medicine without talking to your doctor first. Third, inform your pharmacist. You can bring a list of medications to your pharmacist and inform them that you are diagnosed with celiac disease, so you have to follow a very strict gluten-free diet. Discuss with the pharmacist about hidden sources of gluten, such as excipients. And lastly, you or your pharmacist can contact the manufacturer directly to ask about gluten content in medication, whether the medication is produced in a facility that also processes gluten, and whether they test their products for gluten altogether. More information on this topic can be found in a handout on the CCA website. This is the last segment of our series in managing celiac disease in older adults. Please visit us on our website at www.celiac.ca and on Facebook and Instagram at CCA Celiac. Thank you and have a great day.